I'm going to try and cover a lot of ground fairly quickly. I'm going to get to blockchain and its promise in healthcare and what that's likely to look like in the very near future. But I want to do a bit of setup before getting into blockchain itself. But I want to talk about some of the gaps that we are facing today in healthcare. First, a couple of audience questions. So how many of you have had a video visit with a doctor? So maybe 20, 30 hands, okay. How many have sequenced your genome? Maybe 40 hands. And of those, how many of you have donated your genome to science? Cool, almost everybody. Anybody read Blue Zones? Awesome. And how many of you own a connected chatbot, whether it's Alexa or Google Home or any sort of chatbot? About a third. How many have Bitcoin in your wallet? Put your hands down, the IRS is watching. They want to do capital gains tax on a currency. Other cryptocurrency, how many people own other crypto other than Bitcoin? Okay, a couple. Anybody read Weapons of Math Destruction? It's M-A-T-H, that's not my lisp. Okay, so it's a really interesting, it's by Cathy O'Neil, came out about a year ago, and talks about systematic biases that lead to social inequity and how a lot of AI is being built, a really important read. And The Seventh Sense, has anybody read The Seventh Sense? It talks about how the network effect is leading to natural monopolies. There's a lot of debate in Washington now about the big tech companies and the influence they have. So these are all relevant to what's going on in blockchain today. So a couple of relevant quotes. The philosopher Spinoza said, "Nothing in nature is random. A thing appears random only through the incompleteness of our knowledge." And this was hundreds of years ago, and it's never been more true than today. William Gibson, as Daniel said earlier, famously said, "The future's already here, it's just unevenly distributed." I like to add converged, operationalized, and scaled. And the reason I say that is that we have all these exponential technologies, and yet the uptake of these exponential technologies in healthcare is relatively slow and incremental. I'm going to come back to that point, but the uneven distribution has to do with how we converge and operationalize them. The third one is from Larry Smarr, who said your immune system is booted up by your microbiome, and there's profound evidence that health and disease are determined by the bacteria in our gut. And then finally, Frederick Douglass, who said it's easier to build strong children than to repair broken men. And I think the important point here is we need to spend a lot more of our effort thinking about how to develop healthy habits at a very early age. Now, at an event yesterday afternoon, Catherine, who just spoke, and I were talking about what we were going to cover, and we found out we're both going to talk about sperm, ironically. And she talked about engender and the sorting. What I want to mention is that in the big debate between Darwin and Lamarck, Lamarck was completely discredited as there being any inheritance of acquired characteristics. Turned out that he's right. We now have multiple studies showing that if your father or your grandfather had caloric stress during their puberty years, the cytoplasm and the microRNA in their sperm confer longevity to their offspring. And there are other examples of that, but it's really fascinating. So stress on our parents, stress during the perinatal period, and stress during early childhood experiences, the pioneering work being done here in San Diego on adverse childhood experiences have a profound impact on our health throughout the rest of our life. So I'm going to talk about 6 critical gaps, and this is the setup I want to do for blockchain. So blockchain's the last topic, but the first is the evolutionary behavioral gap. The second is the lifespan health span gap. Third is the empathy gap. Fourth is what I referred to earlier as the exponential incremental gap. The fifth is the incentive model gap, and I'm not going to speak too much about that subsequently, so I'll just mention right now that everybody knows that the fee-for-service model, if you pay people to do stuff, they do more stuff. But if you do it based, as Daniel said, on outcomes, we can convert from a sick care system to a healthcare system and focus more on prevention. The second thing is in large institutions like my own, how you incentivize innovation really matters. There's many different models, and I've actually written a blog about that very issue, about how to incentivize innovation in large institutions. And then finally, the trust and agency gaps, and this is where blockchain promises to play a really huge role, so I'm going to be setting that up. So in the UK, they like to say, mind the gap, pay attention to your customer, and think about it more from a root cause analysis perspective. So we can close all 6 of those gaps with the help of exponential technologies and ultimately create what I call a community-based and personalized behavioral symphony of wellness. by bringing these technologies together and helping them converge and help us achieve our own personal health goals. We also need to renew our focus on healthy parenting and early childhood experiences to build resilience and mindfulness in our children. It is much cheaper to develop healthy habits in children than it is to repair the morbid sequelae of unhealthy habits as a child. And there's actually economists at the University of Chicago that's actually demonstrated this very definitively, that you get a 7x return on investment in children. So the first two gaps are kind of related, the evolutionary behavioral gap. And what I mean by that is that our entire early evolution as a species was based upon our dying at 20 years of old and fighting for every calorie we could get, but now we have an abundance of food, and it's driving the morbidity and cost of healthcare in a huge way. Blue zones have a lot to tell us about that. I'm going to come back to the blue zones. The second gap is the lifespan, health span gap. So who wants to live to be 120 if you're sick from the age of 80 on? So how do we personalize our technology within a community context to focus on building healthy lifelong habits that help us live not just a long life, but a healthy long life? And again, the ACE studies are very informative. If you haven't read it, I highly encourage it, done by Kaiser Permanente here and the Centers for Disease Control decades ago, and they're still the benchmark in that. And then finally, how do we create personal chatbots such as a sage on the shoulder that help us support our own decisions throughout life? So again, Daniel said it well, we need to go from sick care to health care. So this is the first graphic of the evolutionary behavioral gap. And so the introduction of abundance of calories that are very cheap have led us down this path. And not only does obesity lead to diabetes, it also leads to many forms of cancer, heart disease, strokes, and all forms of dementia, including Alzheimer's. So when we talk about healthcare reform and looking at all the policy on the supply side, we're missing the point that a lot of the costs and the morbidity has to do with our behavioral choices. So the blue zones, if you haven't read it, please pick up a copy. Dan Buettner went around the world looking for places where people had long, healthy lives and said, what are they doing? What differentiates them? And these are the 5 sites. And we now have the opportunity to take the information that he learned from that and apply modern behavioral and motivational science to help expand blue zones to other than just a few small locations on Earth. So the 4 things that he found, and most are pretty well known, is diet, exercise, regular, sufficient sleep, and the 4th one that's much less well recognized is having a healthy social support structure. There's a study done at Carnegie Mellon, published a couple of years ago, where they took 400 volunteers, gave them all exposure to a virus, and watched who got sick and how sick they got. Then they looked at their Facebook timeline and did a survey of how many hugs they'd had in the past 2 weeks, and what they found is that people who had a healthy support structure were much more resistant to getting sick and were much less symptomatic if they did get sick. And that was independent of whether or not they were under stress. That it was the healthy social support network that conferred the enhanced immunity. And so those who didn't have a healthy support structure, who weren't under any undue stress at the moment, were more likely to get sick than those who were under stress but had a healthy support, social support system. Really, really important to think about. This is a classic study published in the England Journal of Medicine showing that what we do in healthcare really affects only about 10% of our health, genetics 30%. Our individual behaviors are 40%, and we need to pay a lot more attention to that. And these exponential technologies are going to play a serious role in helping us there. So this is Larry Smarr, who's going to talk tomorrow, I think, and he talks about farming your microbiome. So there's more bacteria than cells in our body. The microbiome helps regulate the genome in a diurnal pattern that affects our immune system and our neurologic wiring. If you give antibiotics to a child excessively at a young age, their brain is wired differently for life. And so what can we do to help farm our microbiome? Most importantly, a plant-based diet with at least 15 different types, and Rob Knight's going to talk about this, 15 different vegetables on a weekly basis, and it turns out that periodic fasting is also really helpful and convergent with our evolutionary history. So how many have seen this book or read it to a child before, Goodnight Moon? Awesome. Okay, so it isn't just that sleep is good to rest. There's been lots of debates about why do we sleep in the first place. But in fact, what we know is that we consolidate memory in sleep, and we also take out the trash. So there's an accelerated removal of amyloid from the brain, and the brain actually has a bit of motion to help excrete the metabolites at night. So sleep and regular sleep patterns are incredibly critical. So how does exponential technology come in? There are a couple of startups that are doing some really interesting things around resilient and mindful health and how you motivate people towards their goals. So the first is WellOp, and they look at the social determinants of health. They look at individualized learning styles. They do motivational interviews, and then they customize the program to address people's issues with both learning styles and motivational tools. Frame Health does a motivational survey and can tell who responds to humor, who responds to very directive kinds of messaging, who responds to multiple options and shared decision making. And we can transform our motivational tools into what I call personalized motivicons in a motivational formulary. So using a motivational formulary rather than a drug formulary. So the third gap is the empathy gap, and there's an epidemic burnout of overwhelmed physicians, and people love to blame the health record, but that obscures a lot of the opportunities to address this issue. Chatbots with open APIs, Daniel talked about that, with self-service and intelligent escalation to a professional as appropriate. VR and AR, I'll come back to that. AI, IoT, and robotics, Neil spoke about that, but these are really going to help offload routine tasks and help restore time, space, and the incentives for empathy. And so when I say incentives, we have very extensive patient satisfaction surveys with everything that we do. And so when physicians know that how their patients respond to them, they have an incentive space as well as time to restore the empathy that they went to medical school for in the first place. This is a cartoon from the LA Times a number of years ago showing just how stressed out the physician is trying to cover everything that pops up at every encounter. Augmented empathy and the role of virtual reality is really fascinating. The Stanford Virtual Reality Lab has shown that if you identify with yourself in a virtual space and then you physically transfer your image off in the distance, you can then transform your image as to gender, as to height, as to weight, as to racial and ethnic background, and build a sort of empathy with that. And Ray Kurzweil, in an amazing interview by Peter Diamandis just last month, I strongly encourage you to take a look at it, said, in virtual reality, you can be someone else. Right now, actually changing your gender in real reality is a pretty significant, profound process, but you could do it in virtual reality much more easily and you can be someone else. A couple could become each other and discover their relationship from the other's perspective. Wouldn't that be cool if we could learn that skill at a much younger age? The fourth is the translational gap, and this is what I refer to as why all these exponential technologies are just not being embraced and implemented in large healthcare enterprises worldwide. And it has to do with that convergence and the operationalization and the scaling. That's really hard. Coming up with a great idea and a new technology is difficult enough, but converging it and operationalizing it is quite a challenge. I'm going to give a couple examples of that. So we also need to make sure that we're using data in our big data analytics and our machine learning that's comparable to what's available to us today so that it's relevant to how we apply it to future data sets. So one of the big things about AI is the training set that you use for a particular machine learning environment has a profound influence. And there's lots of things that Neil articulated that can be traps if you're not careful. So now I'm going to give a couple of examples. And the first is imaging alone. So there's some great apps that do incredible image analytics in healthcare. But if they don't include the other available information to a physician, they are going to fall short in some cases in certain circumstances unnecessarily. So we need to make sure that we have a comparable set of data. So the first one is telemedicine, virtual care, and self-service. That seems really obvious and really easy. You just load up a camera, make an appointment, and away you go. It turns out that the staging of how you get people to make sure that they're registered online when the physician or the case manager is available and they have all the information available and that it's a highly efficient process is difficult, trust me. We've been at it for a couple of years. We're up to about 7,000 or 8,000 video visits a month nationwide now. Second is first responder drones. So I'm just launching a project now with UCSD and the Qualcomm Institute and with Verizon and drone fleet management company they just acquired, to implement first responder drones because they could be anywhere in the city of San Diego or in the county of San Diego in 30, 60 seconds, which during traffic hour is very difficult. The number of components and parts to make that puzzle fit is profound, and so we're just beginning to work on that. Big data analytics for sepsis. This is really interesting because we have our own model of detecting that using big data analytics. But right around the corner are all these exponential technologies looking at the nucleic acid of the bacteria in your blood, and oh, by the way, their antibiogram or their antibiotic sensitivity. So a lot of this is going to change with that. And in the interest of time, I'm going to skip a couple slides and talk about the agency gap. So restoring agency to individuals and communities is really critical. Historically, in the hospital-centric world and the doctor-centric world, it's all been about, I'm going to do these tests on you, I'm going to tell you what's going on, and then I'm going to give you something, a prescription for what to do. But if we're going to go from sick care to health care, we need to be much more concerned about our daily habits and how we think about that. So patient-centric is an oxymoron because patients are what doctors call people. And people have lives outside of being a patient when they just show up in your clinic or your hospital, your emergency room. Seems kind of obvious, but it's a distinction that does make a difference. So what if we each had a personal cloud, as Lee Hood recommended here at this very stage last year, a huge personal cloud of all our health data that we controlled, and that it was maintained using the security and the privacy of blockchain services so that it would be secure and under our control, and that we could apply the best decision support, AI, and machine learning available to our own data without necessarily having to expose that in a much more public space. So the personal health record, which has died several deaths, there was Google Health, there was Microsoft Health Vault, there's been a number of others that have failed to get traction. It may be, it remains to be seen, but it may be that once we have a seamless, effortless process where all you need to do is have your identifier in your blockchain wallet, and that all of your healthcare encounters are automatically uploaded into your personal health wallet, and then you could subscribe to various decision support services to apply to that information, and voila, you have self-service. I think that's a real possibility. It's not going to happen this year or next. There's a lot of people working on it. There's 2 startups alone in San Diego working on this. There's one in Denver, there's a couple in Boston. A lot of people are looking at blockchain and personal health records. So I also want to mention the Theranos mulligan. So in golf, a mulligan is where you get to take a shot over again. Theranos really poisoned the waters, the company that famously promised that they were doing all kinds of amazingly inexpensive testing on microdrops of your blood, but in fact has proven to be fraudulent. And what's happened is they poisoned the water because there's so many cool technologies in that same space that are emerging, and it's harder for them to get funding than pre-Theranos meltdown. But they are progressing nonetheless, and with a Qualcomm Tricorder X Prize and with many other companies in this space, I've seen some amazing stuff that just has to be a little more miniaturized, a little better battery life, and a little less expensive, and some of these are coming to market in the next year or two and are incredibly promising to restore autonomy by allowing us to take care of ourselves. One such service would be for diabetes, because anybody here who's taking care of people with diabetes knows that if they lose 30 pounds, the algorithms with which you treat them absolutely must change. If they injure themselves and they stop exercising, the algorithms change. It may be temporary. Or if they gain weight, it goes in the other direction. So how do we provide a complete set of data and expose it to machine learning that is trained on you? It's your data that it's trained on, and it knows you, and it knows how to adapt based upon your diet, your exercise, your weight, your stress level, your autonomic nervous system tone, which has a profound influence on diabetes management. So there's already some work being done in the space, and I expect that 5 or 10 years, it will be just the standard of care that everybody has their own personalized algorithms for diabetes. And then collective agency in communities, this is where the social determinants of health come in, and how do we make sure that communities restore some of that social support structure that so evidently in the Carnegie Mellon study confers upon us a healthier immune system, more resistance to infection and disease. We will be opening our School of Medicine at Kaiser Permanente first quarter of 2019, and we're embracing these concepts in how we're going to transform the education of physicians. So blockchain and distributed ledger technology, I mentioned a couple of times. It really is profoundly unique in how the technology has been brought together. So how many of you have a basic understanding of blockchain? Just show of hands. Okay, well over half. Does anybody know when Milton Friedman predicted Bitcoin? Any guesses? Okay, I'll answer that in a second. How many of you have Bitcoin in your wallet? Okay. Anybody participated in an ICO, initial coin offering? Okay, it's a new way of funding startups, and a very simple way. So a couple of quotables. Blockchain is simple. If implemented properly, it should be invisible to the user. This is from Micah, the CEO of GEM. And then Brian Bellendorf of the Hyperledger Project said, "We think coalition building is the way to do that. Blockchain allows us to change the physics of data sharing by allowing us to expand secure private access to data in a decentralized, equitable way." So nobody has to own this. It doesn't have to be a hospital system, doesn't have to be a government. It can be in a distributed environment. So 3 critical paths to implement blockchain. The first is just do it all from scratch, which is really hard because you have to build a coalition of different institutions. The second is substitute for an existing platform, and that's what PocketDoc is doing. Or you can have incremental substitution of individual components.
So that I think that the internet is going to be one of the major forces for reducing the role of government. The one thing that's missing, but that will soon be developed, is a reliable e-cash. A method whereby on the internet you can transfer funds from A to B without A knowing B or B knowing A. The way in which I can take a $20 bill and hand it over to you, and there's no record of where it came from. And you may get that without knowing who I am. That kind of thing will develop on the internet, and that will make it even easier for people to use the internet. Of course, it has its negative side. It means that the gangsters, the people who are engaged in illegal transactions will also have an easier way to carry on their business.
So 18 years ago, the economist Milton Friedman actually charted the design of what has become Bitcoin and some of the pitfalls associated with that. Joyce Searles has said that blockchain is like the opposing thumb to the hand of the internet. So the internet was designed to be very free, but not necessarily very secure. So blockchain is an incredibly powerful tool in concert with the internet to provide that kind of security. So how does it work? Basically, each of the blocks in the chain is referenced to the one before it, and there's a hash structure based upon the product of prime numbers. And so you can determine whether or not an entire chain is valid based upon whether or not the hash from each prior block matches the prior block, and the longest chain wins in any sort of contest. This is disrupting every vertical, including healthcare. So in healthcare, personal health records, identity management, global secure data sharing for research and clinical use, researchers, patients, ontologists, digital property management in the metaverse, in the virtual world. How do you assure that something is a legitimate source? And then provenance management, chain of custody for devices, drugs, and truth versus fake news, whether clinical information or otherwise. So blockchain trust companies, this is a book that just came out in July, said the printing press closed the knowledge gap, the steam engine closed the power gap, the internet closed the distance gap, and blockchain is closing the expanding trust gap. And we've become anesthetized a world where we carry the burden to always have to trust but verify almost every transaction. And every company is at risk of being disrupted by a trusted version of itself. Blockchain is not going to cause world peace. Blockchain is not going to cure everything, but it's having profound effects in every vertical. And the ramp up to it, it is a classic exponential. The ramp up to it may be long, but as it begins to take off in each vertical, it's going to disrupt everything. So current concerns, consensus around forks in the software code, resistance to quantum computers. So Google will be using a quantum computer by the end of this year, 49 qubits, which will profoundly disable almost every encryption system based upon prime numbers. So there's a whole initiative right now to make quantum-resistant blockchain. There's some issues about transparency and some issues about the performance of writing to a blockchain. Last thing I want to mention is when we have the ability to manage all of our own data, when we can then expose it to the best machine learning that's really relevant to us, we can have what I like to think of as a sage on the shoulder, where we use natural language processing to convert to neurolinguistic programming and cognitive behavioral therapy, and really begin inspiring healthy habits and healthy reaction patterns and resilience and mindfulness from a very young age. And finally, using exponential technology should help democratize, dematerialize, and decentralize blue zones and extend our lifespan and health span. And this quote from Hubert Humphrey that's hanging in the halls of Health and Human Services in Washington, D.C. has never been more relevant than it is today with what's going on in healthcare reform in this country for sure. It's been said the moral test of governments is how that government treats those who are in the dawn of life, the children, those who are in the twilight of life, the elderly, and those who are in the shadows of life, the sick, the needy, and the handicapped. And all of us, as technologists and entrepreneurs, really need to pay attention to this. I recommend you read Weapons of Math Destruction and The Seventh Sense to understand some of the known pitfalls, and thank you all very much.